Hello all. Hi, people joining. Um, Good morning, good afternoon, to everyone from different time zones. We're gonna go ahead and get started. My name is Ana Luisa Favarão Leão. I'm an architect, urbanist, and researcher at Washington University's in St. Louis People Health and Place Unit. I will be the moderator today. So welcome to webinar 2 of a 3-part series we're conducting on affordable housing and population health. Today's session is titled Methodological Approaches in Affordable Housing for Population Health, the case for the Minha Casa, Minha Vida program. And to get us started, before we hand things over to our speakers, let me run you guys through quick housekeeping points so everyone is on the same page. Shaq, if you can go to the next slide, please. So first on language and captions. So everything you'll hear and see today is in English. So if you'd like subtitles, just click the CC button on your Zoom toolbar and closed captions will appear. Hello to all. Second, about the recording, we're capturing this whole session. So once this video is edited and captioned, it will go up on the People Health and Place Unit website and also in our YouTube channel. So you can expect that within about 2 weeks. So feel free to share that with colleagues who couldn't be here live. And also finally for questions. So we want this to be interactive. So at any moment you can type your questions into the Q&A box. So if it's for a particular speaker, you can just start the question with their name, so indicate who the question is for. And I'll keep an eye for the questions and queue them in the discussion after the presentations. That's it for logistics. So let's go ahead to the next slide, which is sort of a session roadmap. So a quick tour of what's going to be happening in the next hour and why that matters. So we have 4 short presentations. We're going to have 45 minutes in total of presentations, followed by 15 minutes of live Q&A. So stay with us and get your questions ready for that. And today, every talk we have tackles the same housing program, which is the Minha Casa, Minha Vida program, all from a different methodological angle. So by the end, you see how the different pieces fit together and we can build a discussion on it. So the first presentation is going to be by Julia Paiva, talking about the national scale of the program, showing us spatial analysis. She reveals the Minha Casa, Minha Vida's market-driven delivery model and how it reproduces racial inequalities, even though the program does not have explicit racial criteria. And this really challenges us to think what equitable eligibility really is. And following that, we have Flavia Leite, who is going to show us what happens after the keys are handed over to the population. Using court records and interviews, she explores how the condo fee governance and the unregulation of guarantor market can make or break housing affordability and stability for low-income families. Following that, we have Yi Wang, who takes us through the geocoding workflow that has mapped nearly 4,000 Minha Casa, Minha Vida sites in Brazil and explains how linking those sites to climate risks overall will pinpoint extreme heat, drought, flooding, and how these intersect with vulnerable communities. And finally, we have Milena Franco Silva, who steps back and shows us the evidence base, shows us a scoping review that scans almost 4,000 publications and finds what connects housing, health, and climate in Brazil, and highlights the massive gaps and the urgency of the work you'll see today in the webinar. So today we're gonna talk about financial extraction, structural racism in policy design, GIS, evidence synthesis, and you understand more from a mixed method perspective, different layers of the program and how they impact population health and climate resilience. So stay with us. Write down your questions, and we'll weave them into the conversation right after the talks. So let's dive in, and I'll briefly introduce each speaker right before they speak, right before their slot, so we can maintain flow. And our first presenter is Julia Paiva. Julia is a PhD candidate in urban and regional planning at the University of Illinois Urbana-Champaign and a Lehman Center Fellow. Julia's work interrogates racial inequalities embedded in the Minha Casa, Minha Vida program and seeks justice-oriented housing solutions across the global South. Julia, please, the screen is yours. You can go ahead.
Hi, everyone. Thank you, Anna, for introducing me and for this opportunity to present. Please, I don't know who's with the slides, but please move on. So today, I want to start talking about Minha Casa, Minha Vida and the fact that this is the major Brazilian housing policy. It's a mass homeownership program and it has been delivered in units in a standardized way. But in this presentation, I focused on the fact that this is a housing policy that relies on market mechanisms to address social needs. So what it means in practice is that the housing issue has been defined in the terms proposed by the market. And I show in this presentation that it reproduces racial inequalities. You can. So I think this is a great opportunity to try to understand the intersects of housing rights, racial justice, and health, because health is not just dependent on personal choices, it actually reflects social, economic, and political conditions in which people live. And housing is a key social determinant of health, as well as wealth accumulation. So in this presentation, I focus on these two aspects, and I ask us to think about how racial injustice in housing policy can reinforce health disparities. Please move. So my research is focused on Faixa 2 and 3, which is this, let's call sub-programs in which Minha Casa, Minha Vida housing units are commercialized by the private sector. And nowadays, the eligibility is between 2 to 6 minimum wages, and the subsidies are mostly in the interest rate. There is a new Faixa 4 that it's up to 8 minimum wages, but it's not present in this research because it's a new sub-program, and we don't have units delivered yet. So one of the reasons for me to focus on this sub-program is because most of the units were delivered for this income bracket, and because I want to see how the way the market is operating can reinforce racial inequalities. You can move this. So how does it work? The families are introduced into the real estate market to purchase a unit as any other housing units in the market. And the government enters this equation by firstly, you can, a little bit more. Okay. Firstly, subsidizing the loans to construct housing, and secondly, offering subsidized loans to the family to purchase the unit, similarly to the mortgage system in the US. You can. But I interpret this policy thinking about Brazil as a racialized society. So Brazil has been built in the myth of racial democracy, and it has been described as this post-emancipatory society in which people are relating to each other in peace, and there's been this high denial of the existence of racism in the last centuries. But because researchers describe Brazil in this way, because there's a lack of segregation policies, there is a high miscegenation in society, and there is cultural hybridity. But in the end of 20th century, a lot of authors has been describing this as very problematic, because this actually has been formidable ideological weapon against Black and brown people, because Brazil actually has a very racial unequal society. And here, just statistics to show that people with equivalent level of education and experience. The Black and brown population earn 13% less than white people, and the poorest Brazilians are Black and brown, 76%, and this percentage has been increasing. So we can see that racial minorities do not fully exercise social mobility. So then I ask how the model of affordable housing provision of Minha Casa, Minha Vida reinforces structural racial inequalities in the country. And to answer this question, I use an exploratory spatial data analysis and apply principal component analysis and clustering using Minha Casa, Minha Vida administrative data and census data. And I aggregate this in the municipal level. And I look at all municipalities in the country. The objectives is to describe the program design proposition through racialized lens and contrast social economic inequality across the country with the Minha Casa, Minha Vida outcomes, demonstrating that there is a, sorry, can you go a little bit? Didn't finish this. Demonstrating correlation and the regional patterns that exist. Thank you. The results of this paper showed that the policy design, when not incorporating racial lens, actually creates kind of a problem. So we can see that most of the population in Brazil is eligible for Faixa 1 and not for Faixa 2 and 3. But if you remember, can you go? If you click once more. Okay, yeah, this graphic I wanted to show. If you remember this graphic that I showed before, 73% of the units has been delivered for Faixa 2 and 3, but we have less than 40% of the population eligible for this income bracket. And if we look across the country, we can see that in Nordeste, the northeast region of Brazil, has low population eligibility. And when we incorporate the racial aspect of this, we can see that comparing the population, the racial proportion in the population at large and in the eligible population, we see that regardless if it's in the northern part that we have more racial minorities or in the southern part that we have more white population, in the eligible population for Faixa 2 and 3, we have less racial minorities than in the population at large, because this is already an income bracket that it's not that low for the population, and we have the majority of it being white. So I show the example here of two state capitals, São Paulo and Recife, and I break it down by income brackets. So the lowest incomes here, Faixa 1. It's a little bit higher than the population in total, but already in the Minha Casa, Minha Vida Faixa 2 and 3, that here market, we can see that it's significantly lower than in the population at large for both municipalities. And looking at Minha Casa, Minha Vida outcomes, firstly, I applied the Moran's I statistics to see if the units delivered by 100, normalized by 100 inhabitants were clustered, and indeed it is. And we can see in this map how it is clustered. So as expected by the way that it's designed, most of the units are being delivered in the southern region of Brazil. So then I compare this with the subsocial economic characteristics of the country, and I chose the percentage of racial minorities, the percentage of eligible population per municipality, and the GDP per capita. You can pass. And I concluded there is negative correlation between units delivered per 100 inhabitants and the percentage of racial minorities, but positive correlation with the eligible population percentage and with the GDP per capita. So with these variables, I performed the cluster analysis, and besides a few municipalities that doesn't fit in this duality, most of the country is divided by north and south. And we see that the northern region of Brazil has high percentage of racial minorities. Here in the brackets, I show the mean percentage of this cluster, the mean of this variable in the cluster. low eligible population, low GDP per capita, and low units delivered by 100 inhabitants. And in the southern region, we see kind of the opposite. And we can see that there is 6 times more units delivered per inhabitants in a region with low racial minorities, high eligible population, and high GDP per capita. So to conclude, when Minha Casa, Minha Vida is designed following a market logic, it's incompatible with the existing structural racial inequalities within cities and across regions in Brazil. In this sense, Minha Casa, Minha Vida is reproducing the inequalities that we see by relying on unified income-based eligibility and market logic in a society that has race as an important criteria to define access to opportunities. So Brazil is an interesting case to demonstrate that even in the absence of explicit racial criteria, neutral eligibility frameworks and market-driven delivery systems cannot reproduce equal or equitable outcomes in a racially stratified context. Thank you.
Thank you so much, Julia, for this wonderful presentation. That was great, very insightful. So now we welcome Flávia. So Flávia Leite is a PhD student in UC Berkeley with a background in economics and 9 years of professional practice. She explores how formal home ownership affects affordability and stability for low-income households in São Paulo. Thank you so much. Flávia, please go ahead.
Hi, everyone. Thank you, Anna. Thank you, everyone, for organizing this. And Julia, thank you for the amazing presentation. Okay, guys, so today I'm going to present more of a micro level analysis than Julia, and I'm going to focus on the Faixa 1 program of the Minha Casa, Minha Vida. I'm not going to go through what the program is, Julia has already mentioned, but basically here I'm looking at Faixa 1, tier 1 of the program, and so these are low-income families. This is where the housing deficit of Brazil is concentrated. So these are families earning less than, now this level has changed, but it's 2,800 reais a month and of family income. And so these families, they basically get a house for free. So it's not a mortgage, has no interest, no credit assessment. They basically have to pay a 10% of their income to the federal government over 10 years to get that house. Let me give just a step back. Residents, usually they come from 2 origins in the Faixa 1 program. Either they come from forced relocation due to public works and disasters. So they are removed from a favela due to, for example, climate change risk, and they are placed into a Minha Casa, Minha Vida unit, Faixa 1, or they come from a voluntary list. They voluntarily apply to the program. So group 1, which is forced relocation, they don't have to pay anything. Group 2, they must pay 10% of their income to the federal bank, Caixa, over 10 years to get their home under their name. The thing is that these residents, they never pay, they seldom pay this fee for Caixa, and nothing happens. So the default rate in Brazil currently is 67% of residents not paying this fee for Caixa, and Caixa has never foreclosed any of those properties, right? In São Paulo, this rate is 37%. And I talk about São Paulo because that's the case where I'm looking at specifically. Next. Okay, so what do families pay? Previously, before they moved into a Minha Casa, Minha Vida unit, they were either rent informally or owning informally. And basically, they were paying no or very low utility payments. And in this new context, in this new housing, they have to pay condo fees, water, gas, energy, sometimes even property taxes, depending on the local regulation, plus this payment to Caixa Econômica Federal, the federal bank for group 2, for the group of the voluntary people. And so once these condominiums, they are delivered, residents, they must hire a property manager for maintenance and safety and elect a resident, which we call síndico. It's a resident representative to discuss matters with the property manager and maintain the condominium. I'm looking here specifically to the case of São Paulo, where there are no houses. We're not talking about houses, we are talking about condominium complexes. So we're all talking about 4 stories or more buildings. And São Paulo is the only city in Brazil which has faixa projects with elevators. Okay, so that's the context. My research question is, how does the governance of condo fee collection impact MCMV residents, right? And so in that, I have 3 sub-questions. The first one is, what share of those residents have difficulty paying for condo fees? How do property managers respond to unpaid fees, and how this response affect the stability of home ownership? And this is an important question because, as we know, housing instability is a fundamental social determinant of wealth, of physical and mental well-being, right? And here I'm dialoguing with 3 bodies of work. The work of Philip Garbolden and Juliet Varley on urban landlords. We're talking about financial extraction, the work of the Brazilian economist Lena Lavinas, and evictions and foreclosures in Latin America and in the US. There's a big literature on evictions and foreclosure. Matthew Desmond is of course, one of those names. Next. Okay, in terms of methods, and I think here the method is really important because we have scarcity of data, right, in Brazil, and either we resort to public administrative data or we have to collect our own data. And here I opted for the second thing, and so I scraped data from more than 1,158 active and archived lawsuits of property managers, condominium property managers against residents for not paying condo fees. These lawsuits are related to 77, so all MCMV faixa condominiums in São Paulo delivered between 2013 and 2022. And I also analyzed dozens of judicial documents, and I interviewed more than 70 people, including residents, social workers, public defenders, and property managers and syndicals. Next. Okay, so these are my results. So in terms of number of lawsuits per year, we see this increasing tendency of lawsuits. So we have in total 11,000 lawsuits. This is 7% of the households of Minha Casa, Minha Vida. So 7% of these households have already been taken into court in São Paulo. And this is an increasing trend. Next. In terms of financial costs, what we see from this lawsuit. So the average condo fee that a resident in Minha Casa Minha Vida is paying is 255 reais. This represents from 9 to 40% of a family income. Depends how you consider the income, because they range a lot, they vary a lot. This is not including water, gas, and electricity, right? When you see the condominiums as a whole, 1/3 of them, 1/3 of the families living in those condominiums are delinquent. They are in arrears, so they are 2 or more months without paying those condo fees. Every time you don't pay a condo fee, this leads to a fine of 2%, interest of 1%, and inflation adjustments. But if the condominium and the property manager decides to take you into court instead of resolving this default administratively, and it takes you to court, then we have a 10 to 20% legal fees on top of this fine and inflation, right? So that increases the amount of debt the resident has to pay. On average, residents that are taken into court are 14 months late with condo fees and owe about 6,000 reais. This represents from 2 to 10% of their monthly income. Next. In terms of the lawsuits, the results of these lawsuits, we see that 3% have resulted in property seizure, 10% were evolving and probably had already resulted in property seizure when we look right now. 46% 7% are evolving, and 39 suspended. And suspended basically means that the judge is trying to pay back the debt by freezing someone's bank account or other liquid assets. So, for example, it sees that you have some money in your bank account, it sees that you have a car, you see that you have another asset that it can tap into to pay your debt. And so that's what the judge is trying to do with this suspended cases. And in the successful bank account freezes, the average amount taken is 18,000 reais. Just a note on that, 1/4 of the people that have their bank account freezes have nothing in their bank account. So they're in a very vulnerable situation. So when we talk to when we see those lawsuits, we see that the situations that those families are in is a situation of extreme vulnerability, right? So, for example, this woman here, she had 2 strokes, which forced her to leave her job and remain unemployed for 6 years. The situation worsened when her daughter, who is responsible for 2 children, also lost her job. And so they were facing the dilemma of paying bills or providing food. So here, it's a lawyer defending their client, saying they are not paying condominium fees because they don't want to, but because they don't have money, right? Next. So property managers recognize these challenges. So they say these are people who live without any means to even buy a check in this loan, let alone purchase an apartment. And so they have difficulty paying for utilities and condominium fees. Next. And property managers also recognize the unsustainability of operating in this vulnerable environment, right? They say, for example, one said, it becomes a conglomerate of people without resources to maintain the condominium. There will be dozens of actions that will impact the condominium financial situation, resulting in chaos that will become irreparable. So that's a problem in terms of sustainability of these condominiums after they are delivered by the government, right? And so the key thing here is that we have property managers, they must balance this condominium financial sustainability to low-income people's realities, right? And I bring here a very interesting quote from a syndico who said, many syndicos use the condominium to make social justice. I say that there are syndicos more petistas in reference to the Progressive Work Party of Brazil, and those that are more faca na caveira in reference to the violence special armed forces of Rio. The first ones will see a person working as a construction worker whose son cannot buy a pair of sneakers and allow him to continue defaulting. The second ones will not. So we have this dichotomy of how condominium managers deal with this high percentage of delinquency, right? Next. So basically, what I see here is that property managers basically have 3 strategies in face of high delinquency. Either they renegotiate, so we see here big renegotiations events, syndicos trying to help and asking people to pay installments over time, just a percentage, and so on. We have other syndicos that take, and property managers that take more desperate measures, so like water shut-offs, which is illegal, so pressuring people to leave the house if they don't pay condominium fees. Next. And then we have property managers who take more desperate measures, and this is our property managers who hire guarantors. So guarantors are basically companies that haven't been at all in the literature, and they are super new companies that have emerged since the increasing of low-income homeownership in Brazil. So basically, these companies, they guarantee 100% of a condominium's monthly revenue stream in exchange for a fee. So your condominium has a 30% default rate. The guarantor will say, I will guarantee your monthly revenue stream. In exchange, you give me 5%. And in exchange, you give me the right to represent the condominium in court, right? And so they have much more capacity and expertise and resources to go to court and fill these lawsuits against residents. Next. So lawyers, social workers, public representatives and residents themselves, they describe these guarantors as legal loan sharking, as an assault, as a machine of making money. So why is that? Because business risk is too low, because the condominium debt is backed by the housing unit, right? So if no one pays, they just take the unit back. And the return is really high. So for every non-payment, the guarantor gets the administrative fee of 5%, a fine of 2%, an interest of 1%, plus the legal fees that would go to the condominium. So they have very perverse incentives. So the higher the default rates, the higher their gains. So their gains could be up to 38%. And they often do not negotiate as syndicos do, right? They are very entrepreneurial and very straightforward in the sense of if you default, you go to court. And they also operate in this blind spot, in this illegality. So in 83% of a sample that I collected of 200 CNPJs of guarantors, I see that they are not authorized to operate as financial institutions or factoring companies, so they don't have central bank authorization. And they are also not authorized to act as law firms representing condominiums in legal proceedings, yet they do so. So, and has very negative impacts on families, but also on condominiums who give up their income stream to guarantors, right? Next. And I'm approaching the end here. So basically, I ran a regression to try to explain the different why different condominiums have different numbers of lawsuits. So my Y variable is the number of lawsuits per condo, and I'm measuring here the change in log expected count of lawsuits. And I have a couple of control variables. So when you take, for example, the value of the condominium fee. So the higher the condominium fee, the higher the number of lawsuits. This is kind of intuitive. The age of the condominium or the size of the condominium also are representative and positive. So the older the condominium or the larger the condominium, the higher the amount of lawsuits. This is kind of obvious. But what I want to call your attention here is two things. So first, we see more lawsuits in condominiums that where the origin is people who are relocated from favelas or from PAC, so from public works. So were not willingly they did not willingly sign up for receiving these units. They were relocated without their own choice. So usually condominiums made of people coming from risky areas have 373% higher likelihood of having a lawsuit than a condominium where people come from demanda aberta, so they sign up for that, right? Same for PAC, 90% of more lawsuits than a condominium coming from people that sign up for that. And the striking finding here is that condominiums that hired a guarantor have 125% more likelihood of lawsuits than those without. So we see that guarantors are a very predatory way of managing these condominiums after key delivery, right? Okay, just to conclude here, so syndicos and property managers, I show that they respond in very different forms. So some are more flexible and lenient, other are stricter and take desperate measures as water shutoffs or as hiring guarantors. And this instability is of this housing instability post keys delivered in Minha Casa, Minha Vida is increased when we look at the rise of this new unregulated market of guarantors. I show that 7% of residents in São Paulo right now are in court, but this instability can lead potentially to 30% of those residents who are currently in arrears in Minha Casa, Minha Vida buildings in São Paulo. And the big picture here is that we cannot equal housing formalization to stability. So the financial burden and displacement risks associated with formalization of Minha Casa, Minha Vida can undermine the very stability that Minha Casa, Minha Vida is meant to provide to low-income families. And And in terms of health, this has very big impacts, right? So health instability is a fundamental social determinant of health, providing the security and the continuity necessary for physical and mental well-being. And I don't go that deep into the health piece here, but I think it's a very obvious and straightforward conclusion from this piece. Yeah, I think I'm over time. Thank you so much.
Thank you, Flavia. Thank you so much for the wonderful presentations, the very interesting results as well. Our third presenter is Dr. Yi Wang, a postdoctoral research associate at the School of Public Health, Washington University in St. Louis. Yi specializes in the intersection of housing policy, urban planning, and public health. Yi, please take it away.
Thank you, Anna, for the introduction. Also, thanks, Julia and Flavia, for your wonderful presentation. I really like Flavia's presentation on providing a more detailed inspection on evictions in MCMV housing. And I think there is also a lot of literature on the relationship between evictions and health outcomes. I think it would be also interesting to link that with eviction in Brazil's MCMV project as well, because most of the study right now it's conducted in the US. Okay, with that said, I'm gonna shift gear. I'm not going to talk about a completed or nearly completed research project. I'm going to share some of our ongoing research efforts on building a geospatial database for MCMV. To provide some context, this project is part of an ongoing research initiative funded by Washington University's Here and Next Global Incubator Seed Grants. And this research initiative aims to co-create a research framework to evaluate the health and climate resilience impacts of MCMV. And one of the milestones involved in this research initiative is to create a GIS database to map climate-related risks across the MCMV project sites. So why are we doing this? So currently there is no nationwide project-level GIS database on MCMV. The study Julia conducted looks at projects at the municipal level, and the study that Flavia presented, it's focusing on Sao Paulo. And there is also a lot of other published studies that looks at either one of the large metropolitan areas in Brazil or multiple large metropolitan areas in Brazil on like MCMV projects and their impact on the socioeconomic outcomes of the residents. Next slide. However, based on the data that we obtained from the ministries of cities, only 9% of the MCMV FAIXA-owned segment 1 projects are actually located in large cities. As you can see in the table below, the MCMV projects that's located in metropolis constitutes only 9% of the total MCMV projects nationwide. And the majority of the projects located in smaller to medium-sized cities, but there is not enough research on those projects. Next slide. So that comes with our project goals, which is to first geocode all the MCMV projects in Brazil, and second, to link the geocoded projects with climate risk and demographic data. In the colored box below, I listed the data sources that we're pulling from. We downloaded MCMV data from the Ministry of Cities website, where the data has textual description of MCMV project locations. We collected demographic data from the Brazilian census, both the 2010 and 2022 ones. And we also collected climate data from multiple sources, which include data on precipitation, daily minimum maximum temperature, drought index, fire occurrences, and so on. Next slide. So what is geocoding? Geocoding involves converting a textual description of a location into geographical coordinates. So textual description to latitude and longitude of a place. The way that we, can you go back, Shaq? Thank you. So the way that we do it in this project is that we took the description of the MCMV location from the dataset that we downloaded from the Ministry of Cities website, and we sent a request to Google Maps platforms where they host a Google Geocoding API portal, and the API portal will process the textual description and return us with the latitude and longitude of a project. And we use the Python scripts to automate this process. Next slide. So through this process, we geocoded 3,954 MCMV projects that's constructed between 2009 and 2019. And that constitutes over 1.3 million of affordable housing units in Brazil. Next slide. However, geocoding is not always accurate. And this happens the most frequently when you have a poor quality textual description, which leads to inaccurately geocoded results. On the bottom left, I put a satellite imagery, which it shows what correct geocoding looks like. So the four red dots are either located on the border of a MCMV project or somewhere inside that residential complex. But there are also many other situations where due to the inadequate textual description, Google Geocoding API found it hard to locate an exact location, and the results that we receive is usually defaulted to a city or town center or a street center where the MCMV project is located. To operationalize the concept of geocoding accuracy, we define any geocoded points that are over 100 meters or 0.06 miles away from the actual MCMV site to be inaccurately geocoded. Next slide. So the initial results that we got had a pretty low geocoding accuracy rate. If you look at the chart below, at the very beginning, we only have 44% of geocoding accuracy rate, which means that only 44 out of 100 geocoded projects are actually having the correct geographic coordinates. But the way that we try to improve it is to have an undergrad research fellow to do random sampling of the results and manually verify and correct any addresses that are incorrectly geocoded. And we've already went through a couple rounds of geocoding verification and manual correction, and now the accuracy rate, as you see in the chart, it's going all the way to close to 70%. And our goal is to improve the geocoding accuracy rate at the end of the day to 85%, which is the minimum acceptable level for conducting spatial analysis using geocoded data. Next slide. So once we hit the 85% geocoding accuracy rate, our plan for the next step is to integrate the data with climate and demographic information. So while we're doing geocoding, we've also collected data on climate risks across Brazil, which include extreme precipitation days, wildfire risk, extreme drought month, extreme heat days, and also urban-rural categorization and other demographic information. And the next step for this project is to link all the geocoded MCMV segment 1 Faixa-owned projects to climate and demographic data and identify climate vulnerability hotspots and their intersection with socioeconomic factors to inform targeted interventions within the MCMV communities. And that's the end of my presentation. Thank you.
Thank you so much, Yi, for the wonderful presentation. Now, rounding out our presentations, we have Milena Franco Silva, who is an architect, urban planner, and PhD student in public health sciences at Washington University in St. Louis, also a research assistant at the People Health and Place Unit. So Milena, please, the screen is yours. Go ahead.
Thank you, Anna. Hi, everyone. Thank you for the amazing presentations, Julia, Flavia, and E. And today I'm going to share with you some of the findings of our scoping review on affordable housing, health, and climate change in Brazil. And this review is also part of the project that E mentioned earlier. Next, please check. And what motivated us to conduct this review? Basically, because we have already research in the fields of affordable housing, public health, and climate change that has each generated valuable insights and influenced policy in these fields. But we have few studies that explore how these areas they intersect or how they are connected with each other. And we also have limited evidence on the housing's impact on the health of residents of these affordable housing programs. And I would say that this gap is specifically urgent in the context of Brazil, since the country faces deep structural inequalities, as already mentioned by Julia in her presentation. Also, Brazil has high environmental risks, which requires scalable and co-beneficial solutions. And this review we conducted to kind of like find what are the gaps and the current state of art in terms of these three fields. Next, please, check. So the objective of this review was to systematically synthesize peer-reviewed evidence on the health outcomes associated with affordable housing programs, and to explore the connections between these outcomes and climate-related exposures. And the review is divided into two big processes. I will focus on the peer-reviewed process, which is the one that we already finalized and have findings to share with you. Next. So the first step of this peer-reviewed process was to establish inclusion and exclusion criteria to make sure we have a well-defined criteria on which documents we were including in this review. So we were interested in peer-reviewed journal articles that were either published in English, Portuguese, or Spanish, as we have native speakers from these three languages in our team. And all our articles, they should have the focus in Brazil. We didn't establish any time or population restriction. And the outcome of interest, or our dependent variable, was related to health outcomes of the residents of these programs. And the exposure or independent variable that we were interested in was Brazilian affordable housing programs. Next. After that, we did the search strategy, where we made a full list of keywords related to these three main themes. So as you can see from this table, we have a full list of keywords related to the affordable housing context, to our setting, so Brazil. And as you can see, we not only included the name of the country itself, but also the name of all of the states of Brazil to broaden our search, and also keywords related to health outcomes. We then translated these keywords to Spanish and Portuguese and performed the search across 6 databases: PubMed, Web of Science, Global Health, Scopus, Lilacs, and Cielo Brazil. Next. And what did we find? So after performing the search, we found a total of 3,985 articles across the 6 databases. Next. And from these, we deleted 1,185 because they were duplicate reports. The remaining 2,800 were then eligible for the first screening, where we assessed the titles and abstracts. And in this phase, we deleted 2,774 as they didn't follow our criteria. Then the remaining 26 articles were eligible for the second screening, where we assessed the full text of these documents. And in this phase, we excluded 20 articles, mainly because they had wrong outcome, exposure, or document type, which then we had in total 6 articles that were included in this review, which was somewhat surprising to us. Next. In terms of overall characteristics of these studies, their years of publication spanned from 2010 to 2023. Most of them were conducted in the southeast of Brazil, specifically Rio de Janeiro and São Paulo. Their study designs varied, but 2 of them were case studies. And the affordable housing program type that most of these studies focused on was the Minha Casa, Minha Vida program. These programs were located mainly in urban areas, with only one study being in the peripheral zones of the city. And we had a variety of outcomes of interest. So one study assessed diabetes mortality. Another one assessed deaths from sanitation-related diseases. Two of them assessed residents' perception of quality of life. One assessed resilience in the built environment and residents' well-being. And another one assessed residents' self-reported health, morbidity, and lifestyle. And notably, only one study linked the outcome of interest with climate-related exposures, specifically rainfall, flooding, and droughts. Next. So what did we find from these 6 studies? The results were very interesting because they showed that affordable housing programs, they can both impact positively or negatively the health of residents, depending on the health outcome that we are assessing. So, for example, the article that assessed diabetes mortality found that subsidized housing residency was significantly associated with an increased risk of diabetes mortality, especially in low human development index areas. On the other hand, the program that assessed sanitation-related deaths found that the Programa de Arrendamento Residencial, or PAR, led to a 5.6 to 11% reduction in sanitation-related deaths within a period of 2 years. And the authors discussed that this is mainly driven by better infrastructure. So they say that in the end, affordable housing programs, they not only address the housing deficit, but they also improve the urban infrastructure of the areas where they are located. A third article that assessed residents' well-being found a direct relationship between the resilience of the built environment with the well-being of these residents, and also highlighted that poor design and low adaptability of the units of these programs, they can worsen climate and social risks. Next. In terms of quality of life, we had some divergent results across the 3 articles that assessed quality of life. So the one that was conducted with Minha Casa, Minha Vida residents found that the residents think that their quality of life improved, especially in the areas of financial stability, family ties, and access to high-quality resources. However, another study that was conducted in another affordable housing program found that the residents perceive their quality of life as low, especially in environmental and psychological domains, which reinforces that environment can be a social determinant of health. And finally, another article conducted with residents from another program that is not Minha Casa, Minha Vida, reported that residents perceived their health as positively, so it improved their health, but they still showed higher rates of hypertension, cardiovascular, and respiratory issues. And what do these findings tell us? So first of all, they confirm the gap that I was mentioning earlier. We indeed have few peer-reviewed studies that explore the links between the fields of affordable housing, health, and climate in Brazil. We also found a lack of climate focus, as most of the studies, they only focus on health impacts without really connecting with climate exposures. Some studies, they even mention about indoor temperature and the layout of these units, architectural and infrastructure terms, but they don't really explore how these factors might influence health and how they are connected with climate. And we also found a regional bias, as none of these 6 studies included in the review were conducted in the north or northeast regions of Brazil, where we have many programs located and where the highest projected temperatures increases are expected. So to conclude, this review revealed to us that there is a strong need for more studies on the health impacts of affordable housing in the country. We also need intersectional analysis to uncover these overlapping disadvantages related to demographics like age, sex, race, or disabilities, which connects a lot to what Julia was presenting to us before. We also need future research to examine the link between housing, health, and climate-related exposures. And definitely we need more studies in underrepresented regions of Brazil to represent both their local health impacts and their regional differences, as Brazil is a huge country and we have different contextual social and environmental differences across these regions of the country. And that's all. Thank you so much.
Thank you so much, Milena, for the presentation and the very interesting results. We are going to jump into a very quick Q&A. We got very interesting questions in the chat. I separated a couple here, and let's see how far we can get with that. We have 5 minutes. So, first question we have here, I'm gonna do chronological order. So, question for Julia. Julia, do you expect to find similar patterns, that is a mismatch between units and available and eligible racial minority populations for faixa 1, in your research? Do you have any perspective on that?
Thank you for the question. I think that's very interesting, but I think that it's important to understand that faixa 1 operates very differently than faixa 2 and 3. So one of the things that I was looking at is when the program is granted to the market, how its operation going to be done. And as Flavia explained, the public sector has a high influence in who's going to receive faixa 1. So I think it would need a different methodology to assess that, and I would also expect something different. So, in places that we have high eligibility for faixa 1, there's also high racial minorities and also low GDP per capita. We see that there is lower public investments in the states and in the cities. So I wouldn't think that eligibility percentage would be a driver to receive units in the same way that it is observed in faixa 2 and 3. So I would suggest a different methodology to assess this same question for faixa 1.
Thank you, Julia. Now I'm gonna target a brief question to Flavia. Flavia, this question is from Alexandre. How do you perceive that the economic instability, high basic tax rate, for example, impacts the program and residents, and I'm assuming impacts in terms of health?
I mean, if I'm not sure if I understood the question correctly, but in terms of health, I do think it's kind of a question that it has been extensively tackled by the literature in the US, which I'm familiar with, connecting housing stability with health, right? So housing precarity and the fact that you don't know whether you're gonna be in place for a while or not, increases stress, increases anxiety, also increases it has been established that increases the risk of chronic disease. And so it's very much related with poor health outcomes. When you look at the US specifically, my goal in my research, I was not looking at the consequences of the stability, but rather the drivers of this stability. So I cannot properly answer this question, I guess.
Thank you so much, Flavia. I think that is all the time we have for questions, unfortunately, but I want to acknowledge the wonderful questions we received from Gisele, for example, which is a great partner of ours from Curitiba. Also, Jean made a great comment, and questions from Santiago. We'll keep in touch with you guys and get back to you with answers to your questions from our presenters. And right now, we're gonna go ahead and wrap the webinar up. So Shaq, please, if you can, thank you so much. Just finalizing, wrapping up, thank you so much to our speakers and to everyone who joined live. As I said previously, a captioned recording will be available shortly. You'll receive that in a link via email. And this webinar is webinar number 2 of our 3-part series. And we're going to have a bilingual roundtable that will take place in September. So you can watch out your inboxes for details coming up soon. And also wanted to highlight that we have an offer for an international graduate level course. titled People, Health, and Place, International Perspectives on Urban Health, Physical Activity, and Design in Brazil and in the United States. This is a course that will be taking place in August, and you can reach out to us if you want more information. Shaq, next slide, please. So for more information about the course or any additional questions, you can please contact Maurice for English inquiries, and Portuguese inquiries, you can reach out to me or to Milena, which will take also English inquiries if you'd like. So also, please complete the short post-webinar survey that will pop up when you leave the Zoom room. You will receive that via email. We really appreciate your feedback to help us refine our future events. And that is it. Thank you so much to all presenters and participants. Have a great day and see you all soon. Thank you so much.
Thank you.